Good morning, my name is Nas. Today we have a very honorable Dr. Mihir Trivedi from Optive Eye and Retina Clinic in Mumbai. So today we are talking about diabetes. We all know that diabetes is a very common disease, but it is one of the most dangerous disease in India. And India is becoming a hub of diabetes. So today, our doctor will tell us what is diabetes and what are the symptoms of diabetes. Sir, please.
So diabetes is basically uncontrolled sugar levels in the body, and diabetes, the incidence, as you said, the incidence of diabetes and the prevalence of diabetes is increasing in India, and India is the capital of diabetes in the world. As far the eye is concerned, diabetes, uncontrolled diabetes, does affect the eye, and it can cause permanent blindness. That's why control of sugars is very important, and regular eye examination in patients with diabetes is extremely crucial. So that and it is a cause of preventable blindness. So if it is checked regularly, the eye checkup is done regularly, we can prevent complications which arise because of diabetes.
So, what are the symptoms of it?
So initially there are no symptoms associated with retinal problems of diabetes. As the disease progresses, the symptoms start coming in. The common symptoms which start are blurry vision, which is painless. Okay. As the disease progresses further, there can be sudden visual loss, and which is, if it is not taken care of, it can cause a detachment of the retina, which can cause permanent blindness. So to begin with, it is blurring of vision. To begin with, actually there are no symptoms, but as the symptom wise, it is blurring of vision which starts in first.
Sir, is it prevented?
Yes, absolutely. That's the most crucial part of it. And it is one problem which is definitely 100% can be prevented if it is diagnosed at an early stage. That's why we recommend patients who are diabetes to have a regular eye checkup, which includes a retinal checkup. The only eye checkup with vision and with glasses power don't detect this problem. So they have to go to a place where a retinal examination is done, and that, if it is detected, it can be treated early and can be taken care of.
Sir, in India, there are lots of people suffering from diabetes, but sometimes they don't know. So, how can they know about they have a diabetes?
So that's what I was saying. So whenever a patient is diagnosed with diabetes, there are certain things which need to be done. The physician advises the other things, but for the eye, they have to visit a retina specialist or an ophthalmologist who checks for the retinal problems and get their eye tested as soon as they are diagnosed with diabetes. That's the most crucial part. Whenever the diagnosis of diabetes is made, a patient has to visit an eye surgeon and get his or her retina checked. That's the most important part, because if problems are there because of diabetes in the retina, they can be detected early.
So, what the right time of check eyes?
As soon as a patient is diagnosed with diabetes, that's the first checkup, and then depending upon the severity of the problem, the ophthalmologist will advise follow-up. Maybe it can be 3 monthly, it can be 6 monthly, or if the patient does not have diabetic retinopathy, then the follow-up can be annually, every 1 year.
Okay. Is lifestyle can affect on diabetes?
Absolutely. So that is one more important question which you asked. Whenever as far as diabetes control is concerned, we often neglect the role of diet and exercise. So lifestyle modifications in terms of diet and exercise are very important. We've seen patients who have an uncontrolled HbA1c, that means the average sugar which is measured over a period of 3 months, they have it they with medications and with proper diet and exercise. I'm emphasizing on the fact of that exercise, especially walking every day for around 1 hour, is absolutely essential, and that itself can take care of diabetes quite dramatically.
Okay. So, sir, is it a genetic problem or something?
Diabetes, we don't know what is the exact problem, but yeah, there are high chances of it being genetic. Also, environmental factors do play a role, like sedentary lifestyle, unhealthy lifestyle does play a role. But yeah, it's a mix of environmental and genetic issues.
Is any age group of people can?
So diabetes again is divided into type 1 and type 2. Type 1 is juvenile diabetic, which comes sets in early. That can be anywhere around 10 years, can be detected around 15-20. The more common variety is the type 2 diabetes, which sets in usually after 40 years of age, and can set in even after 55-60 years.
So thank you, sir, for giving us such a good advice for who are suffering from diabetes.
Yes.
And thank you so much for coming here.
Thank you very much.